College students across the U.S. are abusing prescription stimulants. Studies show that students do this for two main reasons. One is for academic gain and the other for recreational use. The drugs are mainly amphetamines and prescribed for attention deficit hyperactivity disorders. These drugs are used to maintain focus while studying, as well as abused for their ability to keep people awake in order to study for long hours. Consuming these drugs without being under the supervision of a physician can be very dangerous for an individual and lead to things like heart disease, weight loss, and other dangerous effects. One study showed that 35.5% of undergraduates admitted to taking prescription amphetamines without a prescription. The distribution and prevalence of these drugs on college campuses is increasing. According to the National Institute of Health, a study using 81 college students who were prescribed this type of stimulant showed 61% of them had distributed some or all of the prescriptions to friends or buyers. This stimulant reduces the feeling of intoxication associated with drinking alcohol. The body is less aware of its effects, people drink often way too much, and it can lead to alcohol poisoning and even death. College students are in increased pressure from their friends to party and go out, as well as an increased pressure academically to perform and do well on tests and other activities. An individual is at a much higher risk of using these types of drugs if they have friends or other influences around them doing it as well. The organization students are involved in also has an influence. Students involved in Greek life are at a higher chance of using these types of drugs, whereas students involved in religious groups on campus are much less likely to involve these drugs. The community and environment a student places him or herself into is incredibly important in college. Peer pressure can affect even the strongest of individuals. 21 states have issued prescription monitoring programs that monitor where the drugs are after the patient has filled the prescription. This type of policy helps ensure students aren't selling their Adderall or Ritalin to friends or peers. Policy in some states allows for law enforcement to sit in libraries and coffee shops on campus to look for students buying and selling stimulants around major testing periods. The trans-theoretical model divides a person's steps towards change into 5 stages of motivational readiness. When it comes to the illicit use of prescription drugs, the trans-theoretical model is very useful in describing the current stage of a patient, but is not successful in predicting the best pathway for treatment. The health belief model takes a different approach. The model is broken into 6 constructs: perceived susceptibility, perceived severity, perceived benefits, perceived barriers, cues to action, and self-efficacy. Studies using the health belief model found that education increased the perceived severity of abusing substances and lowered the perceived benefits. Self-efficacy was also increased in patients of that study. It's time we step in and make a change for college students everywhere. In order to create change, the amount of psychostimulant prescriptions needs to decrease. Adderall, Ritalin, and Concerta are overprescribed, and this leads to an excess of pills that are available for distribution. If students are only taking this medication on test days or during exam week, then a doctor needs to consider this when writing the prescription. Studies everywhere have shown that these prescriptions are not being used with their original intent. It is important that we keep into consideration what is actually best for the student and his success in their college career. This addresses both the interpersonal and policy matters that are associated with the social ecological model. From a psychological perspective, there needs to be more done on college campuses to reduce stress in students. These drugs are used in times where students feel unprepared or pressured by their peers. College campuses who have put in mental health programs and stress-relieving activities in a place have shown to have a happier student base. Happy students are healthy students, and we need to be doing everything possible to make sure students are prepared both mentally and physically. This type of intervention shows what should be done on the individual level as well as on the organization level of college campuses. Don't do drugs is something we've all heard since we were in elementary school, but it's incredibly important for our futures and for the environment of college campuses for students to understand the effects of what they put in their bodies. It is easy for a 20-year-old to feel as though they're young and invincible, but we only get one body in this life, and it's time to start treating it right.